So continuing with the assessment of cognitive abilities, one more standardized protocol that commonly used is Minimental state examination. It's also called MMSE. So it has a maximum score and patient's obtained score, which we compare later on. So there would be instructions given. We need to score 1 point for each correct response within each question or activity. There are activities like where the patient has to respond to the questions related to event, episode, and certain activities like copying the diagrams, etc. So the administration time of MMSE might be less than 5 to 7 minutes. Interpretation based on the overall performance score includes if there is a total score of 0 to 10. So the degree of impairment would be around severe. Then if there is somewhere between 25 to 30, then there would be questionable or significant. So it will have impact on psychometric and day-to-day functioning parameters as well. Administering this will give an idea about the cognitive functioning among these senior people. Continuing with the screening of cognitive abilities, one of the widely used standardized protocol includes Minimental state examination, which is exclusively used for screening purpose. It will give an idea about the baseline of the patient's cognitive ability or the participant's cognitive abilities. This has certain items where the patient has to respond either by responding through the answers, like questions would be related to episodic memory or it could be related to attention span. There are tasks which mainly targets the working memory of the patient. Example which includes I would be giving instruction to count backward from 100 by sevens or spell the certain word in a reverse direction. And also there would be task to copy, and there would be use of pen and paper for the examination of the participants' responses. When the patient responds to it, the scores would be given. Based on the total obtained score, the interpretation of MMSE can be done. The scores varies from 0 to 30. 0 to 10 scores indicates there is severe impairment level. The degree of impairment would be accordingly mild, moderate or severe. If the scores are somewhere between 25 to 30, then it may not indicate any cognitive deficits in them. Overall, MMSE will help us to have a baseline before we initiate any intervention strategies. The following video will have a demonstration of administration of MMSE.
So I'll ask you some questions. You have to give me the correct response. What is the year 2020? Season, summer season. Date, 18th April. Day, Thursday. Month, April. Where are we now? Minimental. State, Karnataka. Country, India. Town, Delaware. Hospital, Minimental. Floor, 5th floor. So I'll name 3 objects. You have to say it back. Hair, card, aeroplane. Hair, card, aeroplane. So spell the word world backwards. WLROW. Earlier I told you the name of 3 things, right? Can you say that? Hair, card, and aeroplane. Name these 2 objects. Watch and pencil. Repeat the phrase. No ifs, ands, or buts. No ifs, ands, or buts. Take this paper in your right hand, hold it into half, and put it in the floor. Please read what it says and do as it. Close your eyes. Make up and write a sentence which contains a noun and verb. In writing. copy this picture. Also, okay.